We started about 8 years ago, and what was, I think, different about how we started is that we were a group of not just parents, but different people that intersected the rare disease community. So it was parents and researchers and clinicians and genetic counselors that all were frustrated with the level of care that rare disease patients were getting. And we were all intersecting with kind of rare disease world in different ways. And we decided, I don't even know how we ended up morphing together, but we all decided that something had to change, that patients were falling through cracks, and that we each had a different perspective on how patients were falling through cracks, and that if we brought our perspectives together, we could figure out what we could do together to fill in those cracks. And when we got together, we didn't know what we were going to do or what we were going to be, but we thought that together we could figure out what we could do and see what was missing. And that's how we started. That's how we decided what we wanted to do. What we eventually came to after kind of looking around to see what was in Canada, which wasn't a lot, so it kind of made it easy to figure out what we want to do because there wasn't much, so we could decide what we wanted our expertise to be. And the two things where we saw things really falling down were that for rare disease patients, research really is care. So we wanted to do something about that. We wanted to find a way to enable care-focused research and to enable inspired clinicians and not just doctors, but anybody in the healthcare field to help their patients or their groups of patients where they couldn't before. And we also recognize the knowledge of families and patients in getting together, and instead of kind of sitting in their own little pockets, reinventing the wheel, to find a way for them to get together and combine their knowledge to make things easier for one another. So we decided that those were the two areas where we could really enable the rare disease community to make things better.